The STITCH Trial. Welcome to Everything Surgery, where we explore the extraordinary advancements in surgical practice. Today, we are discussing the STITCH Trial, a landmark study that has transformed the way surgeons approach closure of midline abdominal incisions. Let us begin with the central question posed by the STITCH Trial. When closing a midline abdominal incision following surgery, which technique is more effective in reducing the risk of incisional hernia, the small bites method or the large bites method involving the facial layer? The answer, revealed by the trial, is clear. The small bites technique is considerably superior, cutting the rate of incisional hernia in half without increasing complications such as wound infection or prolonging the duration of the operation. To provide further context, the full title of the study is the Randomized Clinical Trial of Small Bites versus Large Bites for Closure of Abdominal Midline Incisions. The primary objective was to compare how frequently incisional hernias developed 1 year after surgery in patients whose midline fascia was closed using either the small bites or large bites technique. The trial included 560 individuals undergoing elective abdominal surgery with a midline incision. Let us clarify the two techniques compared. The large bites method is the traditional approach, employing a continuous non-locking suture that takes 1 centimeter of tissue from the wound edge, spaced 1 centimeter apart. The small bites technique, on the other hand, uses the same type of suture but takes only 5 millimeters of tissue from the wound edge, with 5 millimeters between stitches. In both groups, surgeons used the same slowly absorbable suture material and aimed for a suture length to wound length ratio of 4:1. The key findings of the STITCH trial are compelling. In the group where the small bites technique was used, 21% of patients developed an incisional hernia. In contrast, 31% of patients in the large bites group experienced this complication. This represents a statistically significant 30% relative reduction in hernia risk for those treated with the small bites technique. Secondary outcomes were also notable. There was no significant difference between the groups in terms of wound infection, burst abdomen, also known as dehiscence, or seroma formation. Importantly, the small bites technique did not require additional time to close the abdomen, and patients reported no difference in post-operative pain between the two groups. Why does the small bites technique work so well? The answer lies in its ability to distribute the holding force of the suture across a greater number of anchor points along the facial wound. This results in a more secure and biomechanically robust closure, reducing the likelihood of the suture cutting through tissue or the wound edges separating, both of which are common pathways to incisional hernia. In conclusion, the STITCH trial provides the highest level of evidence that the small bites technique should be the preferred method for closing midline laparotomy incisions. Its impact has been substantial, prompting updates to surgical guidelines worldwide and establishing the small bites technique as the recommended standard of care for preventing one of the most frequent long-term complications of abdominal surgery, incisional hernia. Thank you for joining us on Everything Surgery. If you found this discussion insightful, please like, share, and subscribe to stay informed about the latest in surgical innovation. Until next time, keep dissecting the extraordinary.